in on this show tonight, this morning, and also our newest sponsor, Dunkin'. All the franchises here in Quincy got together and decided that they wanted to sponsor the Morning Brew, so we are excited to have them here now and going forward as our co-sponsor of this event. For those of you who have tuned in religiously and regularly, you know that this goes pretty quick. We're not asking you to stay on for a long time. And we bring on what we think are the major players here in Quincy and on the South Shore. And there are no bigger players really on the South Shore and in Quincy now than South Shore Health. They have expanded into our city. They have grown their footprint in their Weymouth campus. And they now have a relatively new, although not exactly new anymore, but relatively new CEO, Dr. Alan Smith, who is our guest today. And welcome, Dr. Smith, for joining us.
Thank you very much, Tim. I'm pleased to be here. Looking forward to it.
Great, great. So Alan, tell us about yourself, your background, and what brought you to South Shore Health.
Great. Yeah, thank you for asking. I grew up actually in Western Mass, but I will say that my wife, Denise, spent a good part of her life from junior high through high school in Wollaston and graduated from North Quincy High. I was like to be reminded that she graduated higher in our high school class than I did, but what can I say? And then I went on to become a primary care doctor on the North Shore. So I practiced for 10 years at North Shore Medical Center and I continue to live there, although we're moving now to the area and selling our house as we speak. So I practiced there, got very involved in sort of the medical management and trying to make healthcare work better, and got recruited to come to Tufts Health Plan, where I was involved with the senior product Secure Horizons, and then eventually strategy and business planning. And while I enjoyed the insurance side, I kind of missed being on the provider side and was lucky enough to end up at Brew Women's Hospital. I'm not an academic physician, but I came into the physicians organization, which employs the doctors. And within a few years, I became the president of the physicians organization, which I did for over a dozen years. And we grew that up to about 1,850 physicians. So it was a pretty large organization. And I enjoyed that very much. And I would say 2/3 of my job was running that organization, and a third was leading network development. So the Brigham has many, many strong relationships, including South Shore Hospital, Cape Cod, Sturdy, Milford Regional, and down into the Rhode Island, here New England area. But our biggest and best relationship was with South Shore Health. And I got very involved years ago in helping develop the cancer center that I look right across the street from. So I'm very proud of that, the neurology program, surgery, as well as acquiring Harbor Medical. So I've always been close to South Shore and had enormous respect for it, Tim. But I think until I came in and had a chance, I'd never been up on the floors, the inpatient floors, the emergency department, or the entire campus, to get to know the team here. It's incredible. And I must say, I am so impressed with our colleagues and what they do every day. And we'll talk about that with COVID, but I think this is a really remarkable institution. So I'm incredibly lucky and proud to be here.
Great, great. I know two of those physicians, Doctors Ben and Sarah Ryan, who are related by marriage to our family, and we know how great they are. So if the rest of the medical staff is as good and solid as the Ryans, the Dr. Ryans, then we know it's a great place to go. So
that's great.
And we do know that. My father spent in his later years, and he was a diehard Quincy Hospital guy, but as Quincy Hospital was kind of fading, even he decided it was time to go to South Shore when he had some health issues. So, and they were great to him at the end of his life. And it made us much more aware of what you folks do there and how good the team is. Before I ask my next question, and this is going to be a little bit of a discussion between me and Alan. If anybody on this wants to ask a question, we have the chat line open. If anybody on Facebook Live has a question, they can type it in and Paula will send it to me so I can ask. So I'm asking the questions now, but if you have any questions that you want to ask, Dr. Smith, please feel free to do so in any way that you can. If you have my cell phone number, you can text me. So we're wide open here. Alan, tell us about South Shore Health's facilities in the South Weymouth campus. You just touched on some of them. And more importantly, I guess to us, is the expansion into Quincy, which I believe was started about 2 years ago.
Correct. Sure. No, I'm happy to do that. So South Shore Health expands all the way from Quincy to the north, all the way down to Kingston. When you look at both inpatient and ambulatory, we have one inpatient facility, which is here on Fog Road in Weymouth on Route 18. It's been here we'll be celebrating our 200th anniversary. And the original hospital was on this campus back when it formed in 1922 by Dr. Emerson. And we also have ambulatory surgery and physical therapy and diagnostic and pain center at Two Pond Park, which is right over the line in Hingham. We have 4 operating rooms open and hope to expand that up to 6. And then we have numerous sites elsewhere for clinical care, particularly for ambulatory, with South Shore Medical Center, in Quincy, in Norwell, and as I mentioned, in Kingston. We have a wound clinic and a number of physicians on Performance Drive. So that's sort of our big footprint. I'm sure I've forgotten something, but that's the main thing. I should also mention that we have a very large visiting nurse association and hospice that are down the road from us as well. But they, as you can imagine, do most of their care in the home. So I tend to think of those as much more diffuse, Tim. In terms of Quincy, you're right. 2 years ago, we were very proud to open up South Shore Medical Center's newest site, which is on 1495 Hancock Street. I had a chance to spend the day there back in December. It is a beautiful facility, and we're proud to be there. We have adult primary care. We just started this month pediatric primary care. We have women's health, dermatology, and orthopedics, and we have an on-site lab and imaging. And it is a beautiful building and right in the heart of downtown Quincy. And we're growing, and we are working hard at also being able to provide translation services. We hired an Asian physician who's fluent in Mandarin, which is very important as well. Also in the Quincy area, we have Health Express, which is our urgent care side of South Shore. And I should have mentioned that earlier as well, because we're in 7 different towns with Health Express. And but we're on the Parkway. And if you're familiar with urgent care, you understand that it can do everything from upper respiratory infections, bladder infections, sore throats, sinusitis, all the way up to sports injuries, even lacerations. We do x-rays there. It's a remarkable facility, and it's very well tied in to our facility as well. We also are committed beyond our structure to the Quincy area and recognize it as a growing and important area, a very diverse community. We've been working closely with Quarry, with Philip Chong on a number of initiatives, including recently we recognized the barriers to care. We were able to partner with Quarry a few Saturdays ago to get over 100 seniors. At that point, only seniors could get vaccinated, but we're able to get over 100 seniors vaccinated, many of whom with language barriers and other issues. So we're very proud of that as well, Tim.
Excellent, excellent. I got a question from Pamela, who wants, and it's on this sort of subject about your services, wanted you to touch on behavioral health and the work that the hospital does in the fight against substance abuse, which is a huge issue before and now, especially coming out of COVID. The last year has been really tough on people who have substance abuse issues or fighting them. And talk about what the hospital.
Yeah, it's a great question and so relevant. I'm glad, because that's something we would have been talking about either way. Tim, you're absolutely right. It was a crisis before COVID, and now it's really been exacerbated, and for a whole lot of reasons. And so there's the behavioral health, mental health component, and that spans from kids all the way up to seniors, and all of us are experiencing it in our families and well aware of it. In fact, my wife, who I mentioned before, is a clinical social worker, and she's now doing outpatient therapy for perinatal patients, meaning women who are either pregnant or having trouble getting pregnant or have delivered and are dealing with issues. And it's even more exacerbated by what's happened with COVID. So we've been very fortunate that we got a significant donation from the Graken family, specifically earmarked towards behavioral health, which says so much about them and their vision. And this is prior to COVID. Often these donations are more about buildings and bricks and mortar, but they recognized in a prescient way how important it is to invest in behavioral health. So we've been able to hire clinicians. We actually have a substance use clinic, and we're going to be opening that up at a new site across the street from the hospital. we are seeing a significant number of patients with substance abuse. And by substance abuse, we tend to think of, we go right to illegal drugs, and those are a significant component. But it is pretty evident that the number one issue with substance abuse right now is alcohol. And that is not to say that all alcohol is bad or that everybody who drinks in moderation. That's I do, and I certainly think that there's some science behind that as well. But it is clear that there's been increasing use and misuse of alcohol with COVID. So we have a long way to go. And we also partner with Aspire, who's a wonderful agency in our local area, and we're continuing to grow that relationship. And they bring a lot of excellent clinicians. Here we have a very busy emergency department, and I would say with Quincy Hospital closing, we're actually seeing an increase in the number of behavioral health patients, suicide ideation patients that come to our ED every day, and we welcome them. But we recognize that that Quincy market has its own share, just like everybody else.
Very good. Thank you very much for that and all that you do here. A story or a theme that's been in the news regarding South Shore Health for years prior to your coming, and obviously something that you've had to tackle with is merger mania, I guess is what you call it. We've seen it, we experienced it here in Quincy with our time with Stewart Health and the challenges of trying to find a partner, a stronger partner for Quincy Hospital. There's been talk of mergers, there's been discussions, we read stuff in the newspaper. Tell us sort of the status of where South Shore Health is in regards to that. Are you looking for partners? Are you going to stay independent? What is the current and the future outlook in terms of sort of South Shore Health independence, I guess is the question.
Great. Terrific question, Tim. Before I do that, I do want to mention you had talked about South Shore Bank before. Jim Dunphy is wonderful, as you say. I also want to do a shout out to Pam O'Leary, who's the Chief Operating Officer, who's the Vice Chair of our board and about to become the Chair of our board. So we as well have a wonderful relationship with South Shore Bank, and thank them for their sponsorship as well as Dunkin' Donuts. So recently, we announced that South Shore will remain independent. And this was a journey, and I think a very important journey. When you talk to our board members, and we have a wonderful board, Tim, they stepped back over a year ago to say, should we remain independent or should we be acquired? And I think all organizations need to periodically kind of pull way back and think about where the world is going, where healthcare is evolving, the strengths and weaknesses of the organization, the mission, the commitment to the community. And is it a time in which there should be a restructuring and an acquisition? And in some ways, it's interesting to come in as a CEO in the middle of that. And the group was to kind of slow it down, the board, and allow me to jump in. And I said that the chair of the board, Ken Kirkland, passed me the ball and said, look, can you drive it forward? Not to make the decision, but to make a recommendation to the board. And so there was a typical process with outside consultants who helped us understand our strengths and weaknesses and what was going on in the marketplace. And then we also hired a firm to look at specific options to do a request for proposal process. And we got a number of proposals. They're confidential, so I can't get into details, Tim, but we got some that are local and some that are national. I looked at all of them very, very carefully. Our chair of the board, Ken Kirkland, likes to say that no stone was left unturned, and I would agree. But as I got in here, we really looked at it. I mean, in some ways, if you step back and say, why does an organization need to be acquired? Sometimes there's synergies. So you're thinking like a power company, and okay, we're in this part of the state and another company is in that part of the state, and we can come together, and there's synergies. Another is one can't make enough margin to continue to pay employees, to give people cost of living increases, to reinvest in capital. So in our case, if an OR equipment wears down or an MRI, you have to replace it, or even be able to grow, add new buildings. And so you have to make, even as a not-for-profit, a modest margin. And if you can't do that and you're committed to your mission, then it probably makes sense to be acquired. What we were able to do in the last few months is show that we actually can get back to a sustainable margin. Again, as a not-for-profit, modest 2.5% kind of margins. It's going to be a lot of work in terms of performance improvement, and it will require, as you said earlier, a number of strategic alliances. But we do not need to be acquired. And when one does that, makes that decision, then you sort of lose control. And in fact, we said that we wanted to stay independent, and our board voted unanimously to do this for three reasons. One, because it gives us the power to chart our own path. And a great example is being able to do things like in Quincy. And when you're being controlled by somebody centrally, it's not that they're good or they're bad, but they may have other priorities and you may not be able to be as flexible with what you want to do. So that controlling our own destiny, choosing our own path. Second, our mission. And this is, I will say, I've worked with hospitals all over the state in various jobs. I think this hospital is unique in how committed it is to the community and its mission. I feel that every day here and with the board, and so wanting to be there for the community. And third, our history. When you go back and see how we were founded, and it was really founded to create a great hospital for residents of the South Shore to get care and not have to go into Boston for care that can and should be done in the community. And how this hospital survived the Depression and World War II, which COVID is tough, but I would argue those were even tougher times, and they got through it. And if they can get through it, we'll get through it. And so we're really excited. It does mean change in a good way, and being more efficient, being more available to patients, creating better access, new programs, and that's where a lot of these partnerships come in. But we're very excited about the future, Tim.
Excellent. We are too. We are too. You touched on COVID and the challenges that your hospital, as all hospitals, faced over the past year. We've come a long way since April of 2020. I mean, you think about where we were then, hazmat suits and, people, in hallways, and again, maybe not here locally, but on the news. And it was a true crisis. We know some people who actually made it, and we know some people who didn't make it, through COVID. So tell us, we don't have to go back, because I don't think we want to go back. We don't want to talk about where it was. We all know what it was, but tell us about where we are today and where you think we're going to be over the next few months, especially in terms of the vaccination and, what you're seeing on the ground and in the facility.
Yeah, thank you for asking that. So this has been very difficult for everybody. And that's one of the things I always like to start by saying is we're all human beings. We all have had our own issues with COVID. As you mentioned, Tim, we have family, we have parents, we have brothers and sisters, significant others, children, what have you, colleagues from work, friends. And so no one at South Shore is any different from everybody else in the sense that they're also dealing with COVID from those perspectives. So while healthcare has been unique because it became the epicenter of where we needed to take care of sick COVID patients, I do want to emphasize that every one of our colleagues here, just like everybody on this call today, is dealing with it on a personal level. And I never lose sight of that and how difficult that's been. In terms of us as a system, we've gotten a lot better at it. In a lot of ways, you touched on it, Tim. When we started, this was a brand new virus that people hadn't heard of till December. And so there weren't studies and science to know what to do. Remember when we all thought, I still have a pair of gloves in my car because we were all wearing gloves going to the supermarket. And it turned out that contact by that wasn't what we thought it was, but it turned out, and we were told not to wear masks. And then we realized, no, we do need it. And it's not because anyone was bad. The science is evolving. And we've seen significant reductions in mortality, but they're not 0%. But we found that there are better ways to take care of patients, medications. We still don't have a cure for it. And then thank God for the vaccine. I mean, when you step back and you look at the scientists across the world, and some of this was work that was being done on viruses in the past, but to be able to create a vaccine in a year and have it tested and the safety record that it has, and I'm happy to come back to that as well. I'm not an expert, but I'm happy to talk about it, is really, truly miraculous. And now we have anybody over 16 being able to get it. And I would say, I hope everybody on this is encouraging their family members to get it. And if they're particularly high risk or by age or obesity or anything else, they really, really should get it. It is crucial. But how are we adapting? Well, our numbers have come way down. We charted every day. We had a remarkable team that met every day and managed this. And we peaked at about 97 inpatients in the second wave. And that was a couple months ago. We're now down, just today, we crossed into the teens. We haven't been in the teens in a long, long time. Our census has been hovering in the 20s. So we keep getting 3 or 4 admissions a day, basically. And so it's still out there. And that's would be what I would say going forward. if you look at Israel, where they're ahead of us in getting people vaccinated, they're seeing something like 95% reductions in COVID and in hospitalizations, which is fantastic, but it's still 5%. So our prediction is that COVID is going to be here to stay until we either get full herd immunity or a cure. But that we will continue to have some COVID patients in the house. And the more we can get people vaccinated, the better. I'm also happy to talk about my experience of rounding and going. I try to get up as much as I can on the floors, particularly the COVID floors. But what it was like for our nurses and our caregivers to take care of these COVID patients. I can take that later if you want, but it is so profound and difficult for people to take care of COVID for a whole lot of reasons, and the heroics of our team and everywhere across the country and the world. We cannot thank enough our nurses aides, transport, dietary, our physicians for the courage they had.
Yeah, no, it's a good point to bring up. I mean, you guys, you and every hospital in the country were ground zero. You weren't running away from the COVID patients like the rest of us, trying to stay away from people. You were actually going into the fire, so to speak. And that takes a special bit of courage. It absolutely takes a special bit of courage to do that. And I think people have been made aware of that across the country, how important it is. And as always, we take certain things for granted until we can't anymore. One of the biggest impacts of COVID in terms of healthcare is people who didn't experience COVID or weren't sick enough, weren't sick enough to go to the hospital, or like myself, didn't get it, and I'm knocking wood right now, so haven't gotten it. There's been a lot of discussion about people missing out on other health-related needs, surgeries, cancer screenings, things like that. Talk about sort of that impact as well, not just the COVID, but what COVID sort of did to the other part of the hospital. Is, we were back in the spring of 2020, we were thinking, once we got over the crisis, we were thinking, all right, what companies are benefiting? Obviously, Amazon was benefiting. Everyone was staying home. Uber, Eats was benefiting.
Right.
And we all thought hospitals would be benefiting because you had all these patients. But in effect, in reality, hospitals really got hit badly by this because all elective surgeries were postponed at one point. And I imagine even today, people are probably less likely to go in, even for something routine. So talk about that a little bit and what impact that had and whether or not that's changing as we go forward.
Yeah, it's a great question. It shows your finance background as well as your humanistic background, Tim. You're right. And so in the spring, everything really shut down. And that was both patients who were incredibly worried to leave the house for all good reason, as well as the state, understandably. We were worried that there were not going to be enough beds and ventilators. Again, I agree. We don't completely revisit all those days, but that was tough. And remember the deep worries across the country that we were going to run out of hospital beds, as had happened in Italy. So it really was an issue where people were having to make horrendous decisions about deciding which 40-year-old they would put on within one vent left, and you'd have two 40-year-olds in emergency, and you really had to make that kind of a Solomonian decision. So nobody wanted that. But going forward and looking at what happened, you're absolutely right. There were a lot of people who haven't gotten care. When I talk to our breast cancer surgeons here, they will tell us that on average, patients are coming in with later stage disease. And that can literally be the difference between life and death, Tim, in terms of the staging when one gets diagnosed. We're still not fully up yet with mammography, colonoscopy, things like that. Some of that is capacity issues as well. We are seeing people come back in though, Tim, so I don't want to make it all look dire. But in January and February, when we had the second wave, the state did ask that all institutions stop elective surgery. And as our chief of surgery says, the definition of elective surgery is somebody else who's having surgery. When it's my knee, it's not elective. I'm in pain and I need it now. And that was hard, but we actually did have to stop sort of knees and hips and bariatric surgery and things like that. They're now coming back and we're busy again. And we encourage people to get the care they need, whether it's the physicals they need, the preventive maintenance they need, to have their blood pressure and their diabetes checked. It is extraordinarily important. And to recognize that we have a real commitment to maintain the safety of our patients. So wherever you go, we continue to provide all of the expected CDC guidelines around safety and protection of our patients against being infected with the virus. So, as you probably are aware, there's very little transmission in the healthcare world because we are following those guidelines and wearing PPE, but we will always continue to practice that. But we are seeing more and more patients come in and using virtual care, but we still have a ways to go.
You touched on something that I just was thinking of. It wasn't part of my original thoughts on discussion here, but I've heard it because we see it in terms of, what will the new normal be? Will people come back to the office? Is telehealth here to stay? I know there's been a lot of advances with telehealth and, sort of distance, healthcare where you can do things like what we're doing right here on Zoom. How is South Shore Health involved in that? And sort of what are your thoughts about that going forward?
Yeah, and it's as a species, we're always better about being able to retell history and talk about now. Predicting the future is a dangerous place to be, but I do think telemedicine is here to stay, and I'm very thankful to the state legislature for passing legislation for continuing to make sure it gets paid for. Because one of the major barriers, the technology has been around for a few years, Tim. One of the major barriers was that we're not getting paid for it, or we're getting paid so much less than an office visit that it just didn't make sense for physicians to do that. And I think that's changing. If I had to predict, I think telehealth has revolutionized the treatment of behavioral health, which we were talking about before. And again, I use my wife as an example. We still live on the North Shore. She joined a very good private group of therapists in Newton. And she joined several months ago. She still has never been to the office. All her work is done from the home. And there's really no reason for somebody to have to go in, and it's working very well. At the same time, and I do think there'll always be telehealth, we are a social species, I think, Tim, and I think we do all feel the need to be in the room with each other, that eye contact that's virtual between you and me now, but it really does. Our brains do work that way. And obviously healthcare does work. A physical generally means one does a physical exam, and that's hard to do virtually. So I think there will be a balance of these, but it may also be part of the way somebody gets cared for, where maybe the first visit, even to see a surgeon, is virtual, but then they come in for an exam, they have their surgery, and maybe all of the follow-up visits. We're even learning how to do physical therapy virtually, and people don't have to come in as much. So I think it's going to become part of the portfolio, Tim. But I think our younger folks, the 20s and 30-year-olds, value this even more. I think many of us are still kind of used to the face-to-face, but this is going to evolve, and we'll see.
Yeah. That brings us kind of to the end of the discussion, and I want to give you an opportunity to tell our audience sort of what, and again, I'm not asking you to predict the future, but you have a plan for South Shore Hospital. Every big organization, and even small organization, needs a plan, whether it's 1 year, 3 years, 5 years out. What is sort of the South Shore Health priorities plan going forward in the near future? Or what are you working on as a team so that we have an idea of, number one, that South Shore Health is going to be here for all of us, and that it's going to continue to remain healthy, both financially and otherwise?
Again, great question. And I would say my answer starts with where you ended, which is making sure we are here for the next 100 years. I mean, I think our board and our senior team and all of us here are committed to that. And what does that mean? So in doing this analysis to stay independent, we focused on two major components. One is performance improvement, and the other is strategic alliance. So the performance improvement is about how do we provide more services and more access to the community and meet communities where their needs are. So the Quincy community is going to have different needs than Rockwell or Norwood or Norwell, I should say, or Hanover, what have you. So part of it is that improving primary care access is critical. feature that we've seen, that there's so many patients who don't have a PCP and can't access that PCP. That will be important going forward. We also know we're a very busy place. Our emergency department sees 98,000 visits a year. Where I came from at the Brigham, it was 60,000. This is one of the busiest emergency departments in the state. We're in many ways a critical access hospital for probably 750,000 residents of the South Shore, Tim. So we need to do a better job of managing, because many times our ED is over capacity. I mentioned the behavioral health patients and that importance. We need to find solutions, inpatient solutions for behavioral health, and we're working on that, more ambulatory solutions for behavioral health. And we also recognize that there's a cost component, and we're all paying for healthcare one way or the other. We may think we have health insurance, but in many ways, an employer is giving you health insurance in lieu of wages. So that as those health insurance costs go up, wages don't keep pace, and we've seen that. And we're also taxpayers, so we pay for it one way or the other. So we have an obligation to try to make healthcare more affordable. And I think part of that, Tim, is moving care out. And I'll give you a good example. You know, there are a lot of people who get admitted to the hospital, and if you really look at it, with the right services, could be treated at home. So a year ago, we started mobile integrated health. We already have emergency medical service. And we were trained paramedics with hundreds of hours of training where they're actually delivering care in the home. We had about 200 COVID patients go home, including treating with remdesivir IV at home. And when you really look at it, you realize there's not that much that we would do different in the hospital. So that becomes a mindset change. Now, that doesn't work for everybody for psychosocial reasons, but I think there's incredible opportunity to look at avoiding unnecessary hospitalizations and keeping people healthy at home.
Excellent. Very, very, very good. And I'm far more positive or in, I don't want to say enthusiastic, although enthusiastic is comforted, I guess, going forward after hearing this presentation, because there has been turnover at the top level over the last few years. There has been rumors, and it's nice to put those to bed. I'm glad you've got a supportive board and a strong board that is, helping guide the future, and because we need you. We absolutely need you, not just on the South Shore to make your campus stronger, but the more you come to Quincy, as you said, coming to the patient is as important as the patient coming to you, to the hospital. So
yeah, we need each other, Tim. And I just even want to put a shout out for Manic Community Health Center. I was there yesterday visiting with Cynthia Sierra and the team. It's a remarkable facility, and the Quincy community should be very proud to have that. I'm a huge believer in federally qualified health centers. My daughter's a pediatric nurse practitioner in one in Boston, and I think they provide remarkable care. So how do we support places like Manic so that there's more and more care at home in Quincy?
Yeah, we're very lucky. I try to remind people who are lamenting the demise right now, the physical demise of Quincy Hospital, that we're probably in better shape than we've ever been as a community, even though we don't have a physical hospital, right, because we're all mobile, and it's best to have good quality care and be able to get to it rather than just have the site here. So we're excited about the future. As I know you are, and we're excited to know that you're here because turnover is sometimes unsettling. Mergers, to be honest with you, we don't like them. It's like
I hear you.
Super Soccer League over in
the Super Soccer League that died quickly.
Yes, we don't like that uncertainty, and we don't want people from outside of our state telling us what to do. To be honest,
Amen.
with you, like the local community, I believe in it. Both politically, obviously from a healthcare perspective and even from a business perspective. So it's been very enjoyable.
Thank you. Happy to come back anytime with follow-up, and thank you for inviting me. And I really appreciate, Tim, your warmth and your great questions.
Well, you have a great team. Shout out to Joe Driscoll, who's a longtime friend from Braintree, who has been my contact throughout the changes, and for helping put this together. Again, the Ryans for being great doctors on the South Shore Hospice did a great job with my mom and my dad at the end of their life. I mean,
sorry, but thank you.
Yeah, you've been a part of our family, and for good, and that's great.
Thank you.
And we want to be part of our Quincy Chamber family going forward as well.
Excellent. I appreciate it.
Have a great weekend. Thank you.
You too. Thank you all very much. Take care.
Keep up the good work.
Thank you.
Thank you all
Bye-bye.
for tuning in, either on Facebook or here at the Chamber website. And thank you to our sponsors, South Shore Bank and Duncan, for allowing us to do these events on a constant basis. We'll have a great weekend. It's going to warm up a little bit, so it'll be very nice. Enjoy, and we'll talk to you at the next Morning Brew. Take care.
Thank you. Bye-bye.